So today we're going to discuss the topic of lung cancer and the causes and what that might look like. It's going to be caused from air pollution, smoking, mining, or even car exhaust. Any different air intake that can cause cancer to show up in your lungs. And it can look like a many of different things as well. So here we have your trachea that separates into a Y shape connecting to each lung. And in one of your lungs, a large cluster can show up that can be cancerous, or it can be different clusters and separated in different areas. Now, as you may know, the lungs are separated into lobes, and the right side has 3 and the left 2. The reason for the left only having 2 lobes is because the left is shaped a little different to make room for your heart. Now, when doctors want to inspect your lungs, what they use is called a bronchoscope, and it's a machine with a little tube attached that is equipped with a camera on the end, and they insert it into your nose, down your trachea, and into your lungs to inspect and see if there's cancer. So inside your lungs, you have these little clusters of the bronchi, and if you've smoked for many years, you may have tar buildup, a black tar, thick substance along your lungs. And on the end of these bronchi, there is what's called alveoli, which is like a little air bubble, and that helps with the exchange of CO2 and O2 when breathing. However, this black tar substance on your lungs inhibits the CO2 and O2 from exchanging. And so the problem is that you have a buildup of CO2 in your body, which can cause deterioration, some yellow skin, white spots under your eyes, which is jaundice. And that's what your body might look like. Whereas normally you'd have, regularly pink skin and when everything's working properly. And that tar buildup is what can cause cancer to show up and look like.